Newborn care is a miraculous journey, where every heartbeat and cuddle nurtures the beginning of life. Newborn care. The first 4 weeks of life of an infant are considered the neonatal period. During this period many complex physiologic changes occur, and the infant interacts with the different stimuli. Care during this period should be continuous and effective. Newborn care consists of evaluation for the need of resuscitation, a complete physical exam, administration of prophylactic medications and vaccines, adequate feedings, safe sleep, hygiene of the newborn, and other important areas for baby well-being. Newborn care. Within 1 hour of birth, intramuscular vitamin K should be administered. Prophylaxis with erythromycin ointment to both eyes and injection of hepatitis B vaccine are recommendations, while the baby has skin-to-skin with the mother. Breastfeeding, early skin-to-skin contact and breastfeeding initiation are key to successful breastfeeding. Skin-to-skin contact improves the transition of the newborn, increases the production of maternal milk and makes breastfeeding more effective. Effective sucking and latching should be established in the first 48 hours. If there is a weight loss of over 7% associated with a poor suckling reflex or feeding, supplementation with formula is an option. The volume of feedings can be increased each day during the first week starting at 3 to 17 cc/kg/day on day 1 to 140-170 cc/kg/day on day 7. Vitamin D supplementation should initiate within 2 months in breastfed-only infants. Daily requirements are 400 IU/day. Infants fed with formula and breast milk that consume less than 32 ounces per day of formula should also be supplemented with vitamin D as well. Skin care. It is important to note that full-term newborn infant's skin is covered by vernix caseosa, which protects the epidermis in the uterus from water damage due to its high lipid content and hydrophobic properties. It is recommended to keep it in contact with the skin for at least 6 hours after birth. Bathing. Until the umbilical stump falls, bathing should be done with a sponge to keep the cord dry and is not required frequently. Soaps usually contain surfactants to remove dirt, and this can damage subcutaneous lipid and cause irritation. Diaper care. Diaper care is the ultimate goal to reduce excessive skin moisture. Skin cleansing should be with soft non-woven wipes, water, and emollient cleansers. These wipes should be free of alcohol and fragrance. Urine and stool. Newborns pass first meconium within 24 to 48 hours after birth. Meconium is a black and sticky substance and is the first stool passed by the infant. The stools progressively change to a characteristic seedy, mustard yellow, or green stool with an increase in mother's milk consumption. Infants have a gastrocolic reflex which makes them pass stools with almost every feeding. If meconium passage delays more than 48 hours, the infant should undergo evaluation for pathologies like imperforate anus or Hirschsprung disease. Urine usually is passed in the first 24 hours of life. It is important to remember that it is easy to miss urine when it is mixed with stools or is not witnessed or documented at the time of birth. If true anuria is suspected, the physical exam should be repeated to evaluate genitals and abdomen for any missed abnormalities. If there are valid concerns about voiding, catheterization and ultrasound along with a urology consultation should take place. The parents should receive counsel that vaginal discharge is normal at birth due to maternal hormones and that they might see the presence of urate crystals that look like brick dust, which can be confused with blood. The discharge should happen after voiding and passing stools. Hyperbilirubinemia is common in newborns, and most infants have some visible jaundice in the first week after birth. Jaundice during the first 24 hours of life is pathologic and requires investigation. Jaundice may be due to an immature uridine diphosphate glucuronil transferase enzyme in the liver, elevated hemoglobin levels in newborns, and increased destruction of RBCs. Bilirubin screening is done before hospital discharge, either transcutaneous or measuring serum levels. Umbilical cord. The umbilical cord is susceptible to bacterial colonization and can serve as a port of entry for bacteria into the systemic circulation. Dry cord care is the preferred method as per the World Health Organization. The umbilical cord should be kept exposed to the air, and if covered, it should be loosely covered with a clean garment. If contaminated at any point with stool or urine, it should be washed with soap and sterile water and dried. The umbilical stump usually falls off naturally in 10 to 14 days. Safety. From the moment of birth, parents should be given education and guidance about sleep position, shaken baby syndrome, smoking around the baby, the effect on siblings and pets. Babies should be put to sleep on their back in a crib with the goal of decreasing sudden infant death syndrome, SIDS, with fitted sheets, no blankets or stuffed animals, and no CO bedding.